Hello, everyone. So this is the COVID presentation that you will use for your first COVID assignment, your first week. And I just wanted to walk through some of these slides with you and give you some basic information about COVID. And then at the end of the semester, you will have a semester project where you'll actually learn about the virus with the context of everything we learned this year. And you'll be able to learn more about COVID and the disease. So here's a little background. First, I wanted to talk to you about what is COVID-19. COVID-19 is the disease caused by the virus SARS-CoV-2. And so when we talk about COVID, we're talking about the actual disease of getting sick when you are infected with the virus SARS-CoV-2. It's similar to HIV and AIDS. HIV is the virus, AIDS is the disease, but not all HIV patients make it to the AIDS point. So that's an important distinction, and I'll try to make sure that I say those things right as I go through this. Up here on the top right, this is a transmission electron microscope view of the virus. So this is what SARS-CoV-2 looks like. You can see it in the background of these slides too. This virus is related to SARS and MERS. Those are both the virus names too. And it is spread from droplets and aerosols. And it can also maybe be spread from touching surfaces, but it's probably more commonly spread from droplets and aerosols. So it can also be spread from coughing, sneezing, and singing or speaking, but also just breathing. So if people are just in the same room breathing together, they can also spread it that way. There are also new studies showing that it might be spread by people who never have symptoms, which is asymptomatic, or people who are pre-symptomatic, so they don't have symptoms yet. And it can maybe spread for like 2 days before they get symptoms, maybe more. Some people may spread it for 10 to 14 days or more, so it just depends on the person. And there's even been examples where people spread it for like months afterwards. But there's a lot that we don't know yet, and it's hard to confirm those things, especially when it's at the pandemic level. And it can also spread from surfaces. Those are called fomites, but we don't really know the extent to which they spread that way. We have certainly spent a lot of time like wiping surfaces and sanitizing. This disease is a contagious respiratory and vascular disease. So it's kind of like the flu, but it's also vascular, and that means cardiovascular. So that means that it affects our blood vessels. And it can cause serious illness from, which is known as severe acute respiratory syndrome, coronavirus 2, that's what the SARS stands for. Some of the symptoms are more respiratory, but some are also cardiovascular, like blood clots. And the blood clots can be anywhere, and that can be really bad. Those are the things that can cause strokes, digestive issues. I had a friend who just got her gallbladder out because of it. So there's this is a really weird novel virus. It's really strange, and it's unpredictable. So here are some myths that I wanted to go through, and then on your assignment, you will pretend that you're talking to somebody about some of these myths. It's a quick assignment. So the first myth that I've heard a lot is it is basically like a bad flu or cold. And so this is a graphic that kind of shows the difference and why COVID-19 is not like the flu or a cold. One big difference is that the incubation time for the flu is much shorter, 1 to 3 days compared to 1 to 14 for COVID-19. And most of the time it's between 2 and 7. It has a slower speed of onset. So people will like feel a little bit sick and not know they're sick, and they'll actually be spreading it or not feel sick at all. For the flu, we do have a vaccine that's about 67% effective. We also have immunity from getting the flu before, and we have treatments. We actually have 4 treatments for the flu. For COVID-19, we don't really have any. We currently are rolling out a vaccine, so we'll have some options there, and those are very effective. Most people don't have immunity unless they've had it, and that might be short-lived. And we have only 1 FDA-approved treatment right now, and then there's another one that has emergency authorization. That's all we have. So we just don't have like the tools in our tool belt, and it's really unpredictable. The mortality rate of the flu is really pretty low. It's probably between 0.05 and 0.1%. So that means about 1 in 1,000 people at most would die from getting the flu. And COVID-19 is kind of unknown right now, but it's probably 1 to 3%. We're losing between about 2.5% in the US. So that means 2 or 3 people out of 100 are dying of COVID-19 every day. So I want you to think about, like, picture in your head 100 people, 2 or 3 of them would be dying of it. That translates to 1 in 50 or 1 in 33. So it's a really high proportion. And by comparison, SARS was probably 5%. And you might say, like, well, this isn't as bad as SARS. It probably has half the mortality. That's one of the reasons why COVID has killed a lot more people than SARS, because there are people walking around who are like relatively healthy spreading it. And we don't have as many people getting very, very sick. That's why more people are dying from this. The hospitalization rates are also very different between these two diseases. So for the flu, about 2% of people are hospitalized. You might have had people in your life who have been hospitalized from the flu. I personally have two. I've taken two people to the hospital for the flu, my sister and my roommate, and they both were just given IV fluids and sent home that same day. So, and that's anecdotal. I'm just giving you one example, a couple examples from my life, but the hospitalization stays are often much shorter with the flu. And then by contrast, COVID-19, 20% of people might be hospitalized, so that's 10 times as high. And again, we don't have those tools to help cure and treat people. And the stays can be much longer. So 1 week to many months. They're often on the ventilator, they're in the ICU, they might be in an induced coma to treat them. So it's a very different picture in terms of the hospital stays and also the number of people who are hospitalized right now. And currently, I pulled these numbers as of mid-December. There have been about 24,000 deaths per year in the US from the flu, and that's over like the last 5 years. Probably 250 to 650,000 per year estimated. Those are both estimated, so those are not confirmed deaths. The CDC or the WHO go back later and they figure out like how many deaths there were. And confirmed deaths or reported deaths out of the US as of mid-December, 301,000 from COVID in 9 months. And then in the world, 1.62 million. And those are not estimated. So the WHO and CDC will go back later and do the estimates just like they do with the flu. I think in general, flu deaths are in the neighborhood of like 8,000 reported. And then they estimate the other 16,000. So there will probably be a big difference in how many actual COVID deaths there are. And this is a comparison by age. And so you can see on the left, that's the flu deaths from different ages. You can see it goes way up when people are older than 65. So of course we need to protect our older populations from the flu. But then if you look at COVID by age, over 65 goes from 10.4, 20.8, 30.1% as you get higher. And then it is a lot higher in some age groups, not all, but in some age groups than the flu, especially like over 30, it creeps up quite a bit higher. And then some age groups are the same, like 5 to 17 is pretty much the same. Little kiddos might be a little bit more at risk. And these are old numbers. So we'll know more, right, as the dust settles, hopefully, from all of this. This is another difference between the flu and COVID. So this is a graph showing viral shedding and symptoms of the flu. And so you can see here the black circles are viral shedding and then the white squares are symptoms. And this means that as someone gets infected on day 0, they're going to start shedding virus before they start showing symptoms. But it's only like a day or like half a day. So you are spreading the flu like a day before you show symptoms and you don't know it yet. With COVID, this is the graph. So this looks a little bit different. I'll explain what we're seeing here. The red line is that virus shedding. And then the dotted gray line is virus detection. So you wouldn't even test positive probably yet, but you're already shedding virus. And then your symptoms are probably around the blue line. And this is in a mild case, and then in a severe case, your symptoms are much worse, admission to ICU about day 10, but you're mostly done shedding virus before you even have symptoms. And we're looking at like a few days, like 5 days even, before you start showing illness that you're spreading symptoms. And this is one of the reasons why COVID-19 is such a worse disease than the flu. And another myth that I've heard, myth number 2, it is 99%, 0.9% survivable. That is absolutely not true, especially since currently in the US at this moment, 1 in 1,000 people have died. So if nobody else died today, it would already be at 99.9% survivable. And that's assuming that everyone's been infected. And I have not been infected. My family has not been infected. A lot of people have not, probably only probably a high estimate is maybe 20% of people have been infected. So this is absolutely not true. What we know now is that about 2.3% of the cases die, and then about 20%, so this yellow and red, get severe cases and might have to be hospitalized. 5% are critical, so they're the ones that are looking at multiple organ failure and other problems. This picture right here is very different from the flu. So the number of people that are hospitalized and have severe symptoms who might have chronic health problems later is way, 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 way higher than the flu. Like that doesn't really hardly happen with the flu. They don't have chronic problems. Myth number 3, people don't really get that sick. So I've kind of talked through some of these, but 1 in 5 people become seriously ill and have difficulty breathing and have emergency symptoms. And that's when they need to go to the hospital. If you have those symptoms with or without COVID, if you have any of those symptoms listed here, difficulty breathing, persistent chest pain and pressure, sudden confusion, difficulty walking, bluish face or lips, those are really critical conditions and you need to go to the hospital. And they can develop severe acute respiratory distress syndrome, which is ARDS or SARS. And that can cause pneumonia, cytokine storms, which is what the cytokine storms is when your immune system like freaks out. And that's what really causes the problems with COVID. And then you can have multi-organ failure, septic shock, which is when your whole body is like infected and you go into shock. And then blood clots can happen anywhere. These all can cause long-term damage to heart and lungs. And this is not like any other disease. Another big difference is the loss of taste and smell, which you've probably heard of. What happens is the cells that are in charge of taste and smell, they kind of get sloughed off like a sunburn, and they have to grow back. And sometimes they grow back wrong. So some people will have different taste and smell or no taste and smell afterwards for months. That is a really unique characteristic of this disease. And it's a really, it's kind of nice because it's a symptom that stands out. So maybe more people now know that they have it, and hopefully they will self-quarantine until they get tested. Myth number 4, people recover and move on. What we're finding is that there are a lot of people who are called long haulers for COVID, and they will have some severe symptoms that last a long time. And we don't really know the extent of this either yet, but some of the symptoms are severe fatigue, memory loss, cognitive issues, low-grade fever, muscle weakness, and breathlessness, and this will prevent them from going back to work and resuming a normal life. So like I personally would not like to have those symptoms for months, and so I would just personally rather not be infected with it and keep other people safe. Myth number 5, COVID protocols don't work. This is another myth that I've heard, which is not true. One protocol is masking that we've been using for a while. If you're in in-person classes, you're probably wearing masks in Miles City. They've been studied for decades. We've known that masks work for decades. Your doctors use them when they're examining you for different things, like if they're doing surgery. We know they work. We have a lot of studies about that. There's no question. And the idea behind masks is they're not protecting you from getting it, they're protecting other people from you. So they protect the spread. They're a source control. They're not protecting you from getting it. They might do to a small extent, but the purpose is to keep you from spreading it to others. Here's a little graphic from a study that I read about masking, and I'll kind of walk you through what this shows. So they took a nasal swab from people who were sick with COVID. This is a coronavirus that wasn't COVID. And they sampled how many virus copies they found. And so the mean would be right in the middle of this box and whiskers plot. And then this was a throat swab. So this might be why they're more likely to do nasal swabs now. They pick up more virus. So you can see that they picked up some virus. And then these are without masks and with masks. These are droplets. So droplets are bigger particles like drops. And they found that if someone's not wearing a mask, they detected this much virus in their breath. And then people that were wearing a mask, they detected like 0. And then these are aerosols. Aerosols are smaller particles when the droplets will like break up into little tiny particles. And you can see that without a mask, this is the range. With a mask, it was 0. And these are for viruses. So this is pretty good evidence that masks work and they keep you from spreading the virus, which is what we want. We want to drop that viral load so people in the room aren't breathing it all in and getting sick. And then here's a graphic showing which masks work the best. This is another study, and for both of these, I have the citations on the bottom. And you can see a fitted Mask is going to have the least droplets. So this is relative droplet count. That's the fitted N95. Surgical masks, which are those like blue disposable ones, those are pretty good too. And then this is like a poly cotton. And then as we get out more like a cotton homemade, here are the pictures. These are less effective. And as you get up here to like a bandana, these are not so great. The green one is wearing no mask. So it's the particles that come out wearing no mask. And then a neck gaiter, which is number 11 here, which you might have worn or seen. Those are probably worse than wearing a mask, like no mask, because they cause the droplets to aerosolize and spread. So you probably should avoid a neck gaiter. I know they're convenient and comfy, but they're probably doing more harm than good. And this also didn't evaluate the shields. Those might protect some droplets from spreading, but they're not the best either. Okay, so here's another example of how COVID or how protocols help. This was the flu pandemic of 1918, almost 100 years ago, that we compare things to a lot. And we can see here that St. Louis was a city back then who closed schools and public places. By contrast, Philadelphia had a big parade, and you can see, and they didn't have those protocols in place. Philadelphia ended up having twice the deaths per capita compared to St. Louis. So this is other evidence that it works. This was from 1918, but we have current evidence too. This is from Italy early in the pandemic in March. And Lodi was one town that locked down and Bergamo did not. And you can see the difference here in number of cases. Finally, this was a really interesting thing that we were able to see. Because of some of the measures, the lockdowns, the masking, the social distancing that we did in early 2020, the flu season was also cut short. So this is a graph that shows the flu season in 2019-2020 compared to some of these other previous years. And you can see that it kind of dropped almost to zero by late April, and which is unusual and doesn't usually happen. And especially it wouldn't drop with that drastic of a curve. So you can see that even the flu season was cut short by COVID measures. And there have been studies with the flu showing that like masks keep the flu virus, keep the droplets in, keep you from spreading it. So some of these things have helped in other ways. And if we have both a flu pandemic and a COVID-19 pandemic, those two together could be really dangerous. So we need to keep that contained so that we don't overwhelm healthcare workers and we don't get people sick who we don't want to get sick. Myth number 6 is vaccines are a no-go. So I wanted to show you this recent graph here showing the placebo shots. So these are the people who got a shot, but it was not the vaccine. And the red here is how many people got COVID. They only tested symptomatic people on both of these though, so that's a flaw. The blue line is the people who got the Pfizer shot, and they have to get both. They have to get the initial shot and then another one at day 21. But you can see at like day 10, the number of people getting COVID like dropped like a hammer. And that's really good evidence that the flu vaccine works, and it probably works for a long time. We're looking at 3 months, 3.5, 4 months out here, and people are still having a lower incidence of COVID. I'm looking forward to getting my vaccine. Hopefully by the time you're watching this video, I might have my flu vaccine. I'm hoping. And I'll tell you how it goes. You can ask me anything. And then over here we have how the RNA vaccine would work. And I don't know if you can see all of it with my video in front of this, but the way that the vaccine works is this is the virus. So the blue thing, well, this is what the virus would look like, the blue thing. But they just took a little piece of RNA from the virus and then they put it in a little like lipid shell. So I'm sorry, this is not the virus, but it has viral RNA in it. That's what they take. They inject you with it. So it just has like a little tiny bit of information from the virus. It doesn't have the whole genome, just a little bit of RNA. That goes into you. Your cells are going to make the spike protein, which is shown, I think is this, well, the spike protein is the little green thing here. Your cells are only going to make that part. So they don't have any other information about the virus, just the spike protein. That's the part that infects your cells. And then your body's going to make some antibodies. So these are the little green Y-shaped things. Those are antibodies. Then you will have those ready. And then if the virus infects you, those little antibodies will connect to the spike proteins and block them and keep them from infecting you. And so basically, the vaccine just gives you the information to make this little spike protein so that your body will make antibodies to attack it, so that if you do get infected by the virus, those spike proteins will be blocked and they can't infect your cells. But it takes a few days, like 10 days, to make enough antibodies. So that's why we're seeing on this graph, it's not until like day 10 that you have immunity. So keep that in mind. And you have to get 2 shots. It works better if you get 2. So based on all that, you will complete a little like mock questionnaire about different myths people might have. But this is how we should respond to all of this information. We should be wearing a face covering and washing our hands and avoid touching our faces and doing social distancing, all those things you've heard. We need to really work hard to keep this like lower and keep people not exposed. And you might be exposing people and not even know it. So we really need to be careful of that. And we also need to find ways to stay connected to our friends and family. So we can be smart about this. We can use science to make decisions about this. And now that you are all in biology and you'll have a chance to learn about some of these complex cell processes that are important with COVID, I want you all to be like spokespeople for science and tell people around you what you're learning and what you're learning about COVID and how we can slow this down and get back to normal life sooner. And do more things in person and just be normal humans. So I want you to share this information and knowledge and be a spokesperson for science as you're learning more about it. Have fun with the assignment and let me know if you have any questions.